Hello, this is YouTube Medical University. Among those watching this video right now, there are people who have already developed diabetes even though they were told there were no abnormalities in their health checkups. There are such people. I'm not exaggerating. There is data like this. In 2024 in Japan, there are 11 million people nationwide who are strongly suspected of having diabetes. If you include those who are pre-diabetic, that's about 18 million people. In other words, that means about 1 in 10 Japanese people have some kind of problem with their blood sugar levels. And this kind of data also came out in 2025. According to data released by the International Diabetes Federation, about 40% of diabetes patients worldwide don't realize that they have diabetes. They don't realize it. Why don't they notice? The reason is simple. In the beginning, diabetes doesn't cause any pain or discomfort at all. There's no fever or cough, and you feel fine. It silently advances inside your body without obvious symptoms. That's why it's called a silent killer, such a scary name. However, in reality, there are people who are actually showing signs, they just don't know it. So this time, I'll talk about the 7 dangerous signs of diabetes and the truth about hidden diabetes. What early tests can help you detect it? How should you adjust your diet and exercise? Among the 7 warning signs, you'll be surprised. Wait, these are the symptoms? I've summarized signs that appear in unexpected places like your skin and teeth. I'll also introduce surprising tests that can reveal diabetes, which you might not notice with just a regular health checkup. This is the latest information as of 2026, so please watch until the end. So, first period, why does diabetes quietly damage your body? I'll introduce this based on a very interesting real-life case. If you want to know the 7 warning signs first, please skip ahead and start watching from the second period. You might think diabetes is just a disease with high blood sugar, right? That's not wrong, but that alone doesn't convey how scary it really is. Try to imagine it for a moment. Your body is filled with blood vessels that run throughout your entire body. If you connected them all, it would be about 100,000 kilometers. It's said that they could go around the Earth more than twice. Think of these blood vessels as water pipes. For people without diabetes, ordinary water flows through these pipes. But for people with diabetes, there's a lot of sugar dissolved in that water. So what happens if this sugary water keeps flowing through the pipes? Can you imagine the inside of the pipes getting sticky? Dirt tends to stick to those areas, and the pipes themselves can become hard and more likely to crack. The scary thing about diabetes is that it causes changes in the pipes. In other words, the blood vessels. And if you imagine the water pipes, you'll understand that symptoms tend to appear first in places where there are thin blood vessels, like the extremities or organs. Even small changes can easily cause problems in those areas. This is what's called a complication of diabetes. If the tiny blood vessels in the eyes get clogged, retinopathy. It's said that about 40% of people with diabetes have this change in their eyes called retinopathy, and the kidneys are also made up of a collection of blood vessels. Tiny blood vessels run through the kidneys, so when these vessels are damaged, it causes nephropathy. In severe cases, some people need dialysis. And finally, when the small blood vessels in the feet, which are the farthest from the heart, are damaged, the nerves running alongside those vessels, the nerves become deprived of oxygen, leading to nerve damage. As a result, the sensation in your feet becomes dull, and you might not notice injuries or similar issues. However, these changes and symptoms are hard to notice. In fact, something like this happened in my clinic. A man in his 50s had health checkups every year. The results were normal every time. Both his fasting blood sugar and his hemoglobin A1C, which shows the average blood sugar level, were normal. However, one day, recently he mentioned that his vision was getting blurry, so he went to see an ophthalmologist. He was told that there might be changes in his eyes due to diabetes. After hearing that, he came to my clinic, and when we did a detailed examination, we found that his blood sugar level would spike after meals, going over 200. However, his fasting blood sugar level was normal, and his hemoglobin A1C, which indicates blood sugar levels, was just barely within the normal range. This condition is called postprandial hyperglycemia, and it is also considered a pre-diabetic state in a broad sense. This postprandial hyperglycemia is tricky because it can slip through regular health checkups, so I'll talk about this in more detail in the third section. So, the key points of the first section are that diabetes is not a disease you notice only after symptoms appear, and by the time symptoms do show up, the condition has already progressed. That's why early detection and being aware of subtle changes are important. However, most people tend to dismiss those subtle changes as just signs of aging or nothing serious, so they end up coming to the hospital only after things have gotten worse. So, in the next section, I'll introduce some unexpected physical signs that we doctors notice in outpatient clinics that make us think, maybe this person has diabetes. Now, let's get to the main topic. What comes to mind when you think of symptoms of diabetes? Things like increased urination or feeling thirsty, right? You may have heard of those before. Those are important signs, but by the time these two symptoms appear, the disease has already progressed. So what we doctors look for are earlier signs. I will introduce 7 carefully selected signs that make us think, maybe this person has diabetes. Here is warning sign number 7 that doctors look for: intense drowsiness after eating. Some people might think it's normal to feel sleepy after lunch. A little drowsiness is normal, but if you fall asleep so deeply after every meal that you almost lose consciousness, that's different. People like that might have hidden high blood sugar. Medically, this is also called postprandial drowsiness. When a healthy person eats, their blood sugar rises, and then a hormone called insulin works in the body to lower the blood sugar. However, when you have diabetes, insulin doesn't work well or isn't produced, so your blood sugar rises rapidly. When your blood sugar goes up any higher, it's dangerous. So, the body starts to release a large amount of insulin. As a result, the large amount of insulin takes effect and your blood sugar drops sharply. In other words, it's like a blood sugar roller coaster. This is called a blood sugar spike. According to one study, people who experience larger fluctuations in blood sugar after meals tend to feel more fatigued after eating. Lately, you find yourself nodding off at your desk after meals. You just can't keep your eyes open during meetings. If this sounds familiar, maybe it might not be because of age or lack of sleep. Here is warning sign number 6 that doctors look for. Wounds are slow to heal. Small cuts and scrapes. Normally they'd heal in a few days, right? But even after a week or two, they just won't heal. This could also be a sign of diabetes. In fact, it's said that about 1 in 4 people with diabetes notice that their wounds are slow to heal. Why is it that wounds are slow to heal when blood sugar levels are high? When the concentration of sugar in the blood vessels is high, it's said that the function of immune cells that work to heal wounds becomes less effective. So, because proper immune repair becomes difficult, wounds also become harder to heal. The 7 danger signs doctors look for. Number 5 is this: recurring infections. Recently, you've had repeated bouts of cystitis. You get candida and it just won't go away. You often get mouth ulcers, or you've developed athlete's foot. Does any of this sound familiar? Actually, people with diabetes are more prone to infections. There are reports that the risk is about twice as high. What you especially need to watch out for are infections caused by fungi. Have you ever heard of a candida infection? It's a type of fungus. When blood sugar is high, sugar mixes into the urine. This sugar becomes food for the candida yeast. So in women, candida can infect the vagina and cause what's called vaginal candida infection. Even in men, complications such as itching in the genital area or alcandidiasis, where candida increases in the mouth, can occur. Also, athlete's foot becomes easier to contract for the same reasons. If you thought it was just your constitution or genetics, sometimes that infection is actually a sign telling you about diabetes. Even if you go to a dermatologist, don't just be satisfied with that. Please consider getting a blood test as well. The 7 danger signs doctors look for. Number 4 is this: changes in your gums. Many people don't know about this. Diabetes and periodontal disease actually have a two-way relationship. If you develop diabetes, your periodontal disease can get worse. If your periodontal disease gets worse, your diabetes can also get worse. People with diabetes have about 3 times the risk of developing periodontal disease. And for those with severe periodontal disease, patients with diabetes who also have periodontal disease had about 6 times higher risk of worsening blood sugar control over the next 2 years compared to diabetic patients without periodontal disease. In my own clinic, I've actually had cases where patients told me their periodontal disease was severe, and it was really difficult to control their diabetes. In such cases, when we work together with dentists to properly treat periodontal disease, blood sugar levels also improve. I've often experienced this. It's easy to bleed when brushing, your gums are swollen, and your teeth are loose. This might not just be a dental problem, it could actually be an SOS from your whole body. The 3rd of the 7 warning signs doctors look for: going to the bathroom at night. Lately, you've been going to the bathroom 2 or 3 times during the night. You wake up. Do you think it's just because of your age? However, there are cases where diabetes is hidden. This is based on research from Japan. When about 700 diabetes patients were studied, around 80% of them had frequent urination at night, meaning they often went to the bathroom during the night. 8 out of 10 people. When your blood sugar is high, your body tries to get rid of the excess sugar through urine, and because of osmotic pressure, a lot of water escapes along with the sugar. So if you go to the bathroom more than twice at night, especially if you also feel thirsty, don't just blame it on getting older. It's very important to check your blood sugar, as I'll talk about in the third period, so please keep listening. The second dangerous sign doctors look for is changes in the skin, the back of your neck, under your arms. Are they darkened? This is a sign that doctors can recognize at a glance. The back of the neck, under the arms, and the groin area. If you notice dark, rough changes in areas where your skin rubs together like this, it's a sign that your insulin resistance is increasing. What is insulin resistance? The pancreas produces a hormone called insulin that lowers blood sugar, but insulin resistance means your body isn't responding to it properly or it's becoming less effective. In other words, even if you don't have diabetes yet, in the stage just before diabetes, your body is already showing increased insulin resistance. Insulin isn't working as well. This is important, so if you notice this darkening of the skin, it's a sign that you're one step away from diabetes. It's possible. Even if your blood tests during a health checkup don't show anything abnormal, your body is already giving you signs. In fact, in a large-scale study in the United States that investigated about 1,700 patients, about 19% showed changes in skin color, and among those with these skin changes, about 77% had insulin resistance. In other words, their bodies were becoming less responsive to insulin. It had already started. The American Diabetes Association also recognized these skin changes as a risk factor for diabetes as early as the year 2000. If you're watching this video right now on your smartphone or TV, please try touching the back of your neck or under your arms with your hand. Do you have any dark, rough patches? If you notice anything like that, please consult your regular doctor. Consult an internal medicine or dermatology specialist. Warning sign number 1 of the 7 signs doctors look for is numbness or tingling. If your feet tingle, your fingertips feel prickly, or it seems like a thin layer covers them despite not wearing socks, these are the sensations we're discussing. These could be signs of diabetic peripheral neuropathy. Pain is easy to notice, but what's characteristic here is these subtle changes in sensation. In fact, data shows that about 35% of patients who are newly diagnosed with diabetes already have these symptoms. There is data showing that these diabetic neuropathy symptoms were already present. At the moment someone is told they have diabetes, 1 in 3 people already have these kinds of symptoms. Since these complications can appear as early symptoms even before a diagnosis is made, please make sure to check for them. Why? Why are the nerves in the feet affected? The feet are the farthest from the heart, right? And when the smallest blood vessels in the tips of the feet are damaged by high blood sugar, symptoms are most likely to appear there. When the small blood vessels in your fingertips lack blood flow, nearby nerves. The nerves get damaged, causing numbness and other symptoms. By the way, there are also tiny blood vessels running through your fingertips. Many people experience similar symptoms in their toes and fingertips. In other words, remember that symptoms often appear in areas where you wear gloves or socks. And what's even more concerning is that while having these symptoms is one thing, as the condition progresses, some people may stop feeling numbness altogether. In other words, you lose sensation in your feet, so you might not notice if you get blisters from your shoes. You might not even realize if you burn your feet in hot water. There are even patients who didn't notice when a nail was stuck in their foot. And since wounds are hard to heal, bacteria can enter, cause infection, and sometimes foot amputation is necessary. There are patients like that too. In other words, numbness is proof that your nerves are still alive, so it's really important to take early action while you still have these symptoms. How did you find the 7 danger signs? Let's review what we've covered so far. 7th place, intense drowsiness after meals. 6th place, slow healing of wounds. 5th place, recurring infections. 4th place, gum changes, periodontal disease risk triples. 3rd, nighttime bathroom trips. 80% of diabetes patients have this. 2nd place, darkened skin on the back of the neck and underarms, which appears before blood sugar rises. 1st place, numbness and tingling in hands and feet. 35% have this at diagnosis. If you have experienced 3 or more of these symptoms, please visit an internal medicine clinic, your regular doctor, or a diabetes specialist for a checkup and testing. And it's important not only to check your blood sugar levels, but also to measure your average blood sugar value, known as hemoglobin A1C. And finally, in the third part, even though both your fasting blood sugar and hemoglobin A1C are normal, there are still cases where diabetes has already started. In the third part, I'll talk about these blind spots in health checkups and how to better manage diabetes. I'll briefly summarize the dietary and exercise habits. Now, this is crucial. In the second part, I discussed bodily signs. Some of you may have thought this. You might think, I don't have any symptoms and my health checkups are normal, so I should be fine. Unfortunately, that's not always the case. There are patients like this as well. Their fasting blood sugar is in the normal range, between 90 and 160. Hemoglobin A1C, which reflects the average blood sugar over the past 1 to 2 months, is also in the normal range, usually in the low 5% range. However, when we measure their blood sugar after meals, it exceeds 200. If your blood sugar level 2 hours after eating exceeds 200, that's enough to meet the diagnostic criteria for diabetes. In other words, even though this patient appeared normal during checkups, their post-meal blood sugar levels had been at diabetic levels for the past 3 years. This is the biggest blind spot in health checkups. What I want you to know is your fasting blood sugar level. Rather than your fasting blood sugar, it's your post-meal blood sugar that starts to rise and gradually brings you closer to diabetes. This is common knowledge in the medical field. So even though there's no fire yet, there's already smoke. That's what checking your post-meal blood sugar helps detect. Even if your fasting blood sugar is normal, it's said that about 30% of people experience high blood sugar after meals. So what should you do? There's a test for this. It's called the glucose tolerance test. In this test, 75 grams of glucose are dissolved in water and you drink it. Then, over the next 2 hours, your blood sugar levels are measured at several points to see how they change. In other words, it's a test where you drink sugar water and check how much your blood sugar rises. This test lets us see how much your blood sugar rises after eating. It's a very important test for finding hidden diabetes that might be missed during regular checkups when you're told everything is normal. If you watch this video and feel concerned, or if you have a family member with diabetes, if you recognize any of the signs introduced in the second part, please visit your regular doctor or a diabetes specialist and ask about getting tested. And finally, I'd like to talk about some key points regarding diet and exercise. First, about diet. What I want to advise today is to change the order in which you eat your food. In 2015, Cornell University in the United States conducted a study. Even when eating the same meal, they compared a group that ate vegetables and protein first and then carbohydrates with a group that ate carbohydrates first. The group that ate vegetables and protein first had about a 29% lower increase in blood sugar levels 30 minutes after eating. 1 hour after eating, it was about 37% lower. In other words, even if it's difficult to change what you eat in your diet, anyone can change the order. Just by changing the order, there's this much of a difference. So it's veggie and protein first. Eat vegetables and protein first. And I also recommend chewing your food well. Just being mindful of these things can change how your blood sugar rises, so please try to keep them in mind. Are you paying attention to? If you'd like, please let me know about your meals in the comments section. And about exercise, it doesn't have to be perfect. How about exercising for just 15 minutes? According to an American study, people at risk for diabetes, when elderly people were asked to do 15 minutes of light walking, there was a clear report that their post-meal blood sugar spikes were significantly reduced. Just 15 minutes is enough. Try taking a short walk after a meal. After taking out the trash, walk for just 5 minutes before coming back home. That's all it takes. And blood sugar levels rise about 30 minutes to an hour after eating. So if you move your muscles during this time, the sugar is used up by the muscles, making it easier to lower the blood sugar peak. Please be mindful of the timing of your exercise. Here's a summary of today's lesson. In the first period, I talked about why diabetes is called a silent killer. Using water pipes as an example, I explained the mechanism of how blood vessels get damaged. In the second period, I introduced the 7 warning signs that doctors notice. These include intense drowsiness after meals, slow healing of wounds, recurring infections, and changes in the gums. Going to the bathroom at night, darkening on the back of the neck, and numbness in the hands and feet. And in the third period, I explained that even if your health check results are normal, you can't be completely reassured. The reason is that even though hemoglobin A1C levels were normal, I introduced a case where post-meal blood sugar levels were at a diabetic level. I talked about how just changing the order in which you eat can help control blood sugar spikes, and that even just walking for 15 minutes after a meal can help lower blood sugar levels. Some people may feel anxious after watching this video, but the fact that you've watched this far already means you've taken a step forward. The sooner you notice diabetes, the more you can do about it. It's never too late, so today, when you've realized it, is the earliest day. Please try not to put too much pressure on yourself. Please try even just one thing that you think you can do. And now, an announcement. YouTube Medical University has created an official Line account. If you register for the official Line from the description box, we are distributing materials that summarize today's lesson. Everything is summarized on a one-page handout, including dangerous signs and information about diet and exercise. So if you'd like, please register and type in diabetes. We will distribute the materials for free. If you found this video even a little helpful, please hit the like button. And I would be really happy if you could also hit the subscribe button. See you in the next video. As a general practitioner, my patients have shown me how to thrive past 70. I want to live this way too. I didn't know this lifestyle existed. These stories share what I've learned. Socializing with friends matters more than exercise, and with medication, less is often more. It's filled with the wisdom I've learned from my elders on how to live healthily and happily no matter how old you get. Please check it out from the description below.